2. Okay.
Hi. Today, welcome to our Facebook Live. This is Aspire in-home healthcare, and we're so grateful that you would decide to join us today. So, usually I'm with my friend Wendi, who happens to be on a vacation with her family, and we hope that she's having a really, really wonderful time enjoying the beauties of Southern California. And so today with me, I have my friend Ty. And Ty is our hospice director of nursing. Ty, tell us a little bit about yourself.
First of all, it's a pleasure to be on here. It's a hard shoes to fill when you're trying to fill a person like Wendi. But she's like she said, she's on a well-deserved vacation. She deserves that. She makes sure that I'm successful, actually. So about me, I've been a nurse for near on a decade now.
Right.
Surgical services is kind of where I started my gig. Went through into the travel nurse, ICU, ended up in end-of-life care because I loved it.
What do you love about end-of-life care?
Well, having had family members that are on hospice services before and going through just, how do I want to state this? There's a lot of emotional things that happen at the end of life.
There is
a lot of things that even the most experienced individuals need help walking through that.
Like even an experienced hospice nurse can be put into a situation with her parent, say her father or a mother, that is beyond her ability. And we often talk at Aspire about the patient and family chair.
And it's a very true thing, and she'll explain this to you.
Right, that when it's your turn. We've seen doctors, neurosurgeons, nurses, that when it's their turn to experience having their parent, their loved one on hospice, it is a much different experience.
Yeah, just recently we actually had a family member who was an anesthesiologist, and those guys, they are quite experienced.
Very experienced.
In the realm of medications and pain management and how to do this. And even them, they felt crippled and needing a lending hand from a simple nurse like myself.
Right.
Because that experience just kind of flies out the window.
All your knowledge flies out the window. You become almost like that child again. And it's very hard to be thinking about logically, what do I need to do when the emotions of the moment take over? And one thing is I have a lot of respect for Ty is his respect for that sacred moment that it does when somebody passes. And I do know that when he's attending a person's death, he takes that and prepares himself very much spiritually to be able to go into that space to meet people where they need to be met. And I respect that a lot about you.
Thank you for that. It is a spiritual time. There are two of the most spiritual times in your life is at the birth of a child and the death of a family member. And both times you'll see that, like we said before, even the most experienced people need that helping along, especially almost in a spiritual, almost like a social work type realm, to where that guidance of emotion and that guidance of spirituality needs to be met.
Right. Because we are physical beings.
Hannah's saying hello.
Who is?
Hannah.
Anna, hi. Thank you for joining us today. All right. So we're talking about the really spiritual nature of hospice, and it's a really hard topic. And we've changed our name. And one of the benefits of changing from Aspire Home Health and Hospice is that we've dropped this very negative word called hospice.
Unfortunately, I'm well affiliated with that word, and it does have a negative connotation to it.
But there is the hospice benefit. Medicare is one of the most beautiful things Medicare ever has done, was to put together this very beautiful hospice benefit. And a lot of people, we were just talking about that this week, about how one of our nurses' families, so she's a nurse in our office and her family's considering hospice, and they told her when she sat down and meet with the family, well, isn't that for the end of last 3 or 4 days of life? And it's not.
I mean, we do want to be in there for that time frame,
Yes,
so it's not necessarily an inaccurate statement. But in my experience, people don't get on soon enough because they need that assistance and that quality and that extra, just that extra, I guess is the best way to verb it, is just they need extra.
Right. So, Ty, what are, one of the biggest questions we have for families is, how do I know when it's time for hospice? And what is some of your experiences with that?
In my experience, when you start to see your family member or loved one, they're just getting more tired. They're requiring more help. They are diminishing in the amount of stuff that, like food that they're taking in, water that they're taking in. And a lot of times it's not necessarily based just on like, hey, I was diagnosed with cancer. Hey, I was diagnosed with this. Sometimes it's just that their body starts to fail.
Right.
And what is a failure? It's the same thing with a vehicle. A vehicle, you take it in for a checkup. Sometimes they can fix it, sometimes they can't. When it gets to the point when those struggles start to show, that's when you need that extra help. You need that lending hand. And that's when we come in. And a lot of it is helping that mindset come through that, hey, this is what I'm seeing. This is where I've been. This is where I'd like to go. So help me get there.
One of the big things is when somebody gets tired of seeking curative, and we talk about this, and we want to really simplify. What does it mean to go after curative care versus comfort care? What's that difference there, Ty?
Anything that's restorative, something that's going to restore or to heal.
So let's take this even simpler. An example: mom falls and needs physical therapy. That would be an experience of
restorative care.
Or let's say someone gets a diagnosis of cancer and they're actively seeking chemotherapy.
Even though chemotherapy is not always considered restorative, it is restorative in this nature.
That it's trying to heal.
It's trying to heal or delay.
That's right. It's trying to help the body get over the what's going on with it. Now, let's say mom is older.
Mm-hmm.
She's not eating as much and she falls. And she says she's tired of going to the hospital. And she's tired and doesn't want to do physical therapy. And she doesn't like the meds that the doctor. What's that?
That is more in the realm of what we help with.
Okay.
We come in, we take into consideration all those statements that the patient family member makes and that they want to seek a comfortable time. We want to make sure that their base focus is on that comfort. So if they're in pain, we treat that pain. If there's something that's causing some sort of discomfort, we treat that discomfort. But we're not going after that underlying condition and trying to make that better. We're just trying to make the symptoms that surround that something that is comfortable for them.
Right. So my dad, he's 83. Did I get that math right? Yes, I did. Yay for me.
Congratulations, Kris.
Yay, I did. But he's really struggling with a lot of cardiac issues. And he's still trying to walk, trying to get out to the doctor. And even though I work in the industry, he tells me, I'm not listening to you, Kris, because you told me wear tet hose and I'm not listening to you. But he is someone I'm keeping an eye on.
Yes.
He's lost 30 pounds without trying.
Wish I could do that. I was throwing that out there.
We all wish we could just lose weight magically, but we can't. But he loves food.
Uh-huh.
I happen to know how much he loves food. And for him to have lost this much weight, and so I'm kind of secretly keeping track. Also, I'm watching him get urinary tract infection after urinary tract infection, and his mobility is getting such that he can't walk. He's walking, but for him to walk even 25 feet taste.
You're hitting a lot of flags and spidey senses over here.
Right. So now the doctors put in a catheter in my dad to help with all of the urinary retention and things like that. So it's not just like there's this magic moment that you go, oh, it's time for hospice, but there's all these little teeny tiny signs. And I keep telling my mother, you don't have to do this alone. We can have help. But she's like, you know your dad.
And there's no shame in that help either.
Right. That's why the government has put this, Medicare has put this beautiful program in, is because they know it's my mother who's the most tired. My mother who's busy taking care of everything, all the caregiving, all of the go get the medications, go get the food, go here, drive here.
Yeah, we're a support. And we base everything that we do in teaching. And bringing that teaching in, even that in itself is a help, because sometimes you don't always know as much as you think you know. Well, I'm guilty of this frequently.
It's me. I think I know so much.
You get a professional in there that's like, hey, this is an easier way to do this. This is something that's going to be less taxing. This is what's happening, and this is how we can help. It's a godsend in a lot of ways.
It is. And it's somebody who is not emotionally involved like I am as that daughter.
Saying we need to kick you out, Kris?
Well, I'm already been kicked out. He won't listen to me. I told him to wear tet hose, and that was bad. So he doesn't listen to me anymore. So really, when we're looking for the big picture of hospice, it is really like a really overhauled, really big step of decline. It's not just, these are very marked, simple things though.
Mm-hmm.
Lack of, you've got your declining health status. Maybe you've got some new medications. You're falling a lot. You're going to the hospital a lot. The weight loss.
And wounds that just won't heal.
They're not as energetic as they should be. There's just a lot of small signs along the way.
It's kind of like when as you're progressing through life, you're trying to climb this mountain.
Sure.
And to reach, whatever that top looks like for you. And as we see people start to go down the other side, there's a point in which hospice is appropriate.
Right.
And it's not always this like major drop off like this. Oh my goodness, we just got this new information and we need to go now. A lot of it is just this slow, steady going down this other side of the mountain. But until we reach this point where you're going to need that.
But a lot of people are so afraid.
Yeah, it's definitely fear.
It is not, when you put someone on hospice, you're not signing a death certificate.
No.
Right? Hospice isn't about giving up. Hospice is about comfort, dignity, and support, and living your best quality of life that you can.
Quality of life is my favorite term for this.
Why? Tell me about that.
There's living, there's not living, and then there's living well. And what we try to do, and what we're wildly successful in doing, is once we've reached the point where we're just living, we come in and we turn that living into a quality living.
Right.
And does that mean that we're going to fight this disease all the way to the end? No.
It's really interesting. Scientific studies have been done that have shown people who go after the curative, the heavy treatments, we're going to beat this to the very end, actually have less of a longer life, where when you choose hospice can actually extend someone's life up to 3 months.
Yeah.
I mean, that's a gift of 3 months versus going after this. We're going to fight so hard that ends up robbing you of time, quality of life, and some comfort. And it robs you of actual time.
Yeah, and that time is the thing. And what obviously you could fight and get a little more time, but what does that
Could
time
you?
look like?
What's the quality of life?
What does that look like? If you're back and
Mhm.
forth running to the hospital for every appointment, you're spending most of your time in the car and in the waiting room. As for me personally, and this is something that I've had to express to my grandparents, because much like you talked about with your father, trying to get my grandparents on service, that was a chore, even though
That's
in
what
the
you do.
industry. But
Mhm.
the amount of quality time that I was able to spend with my grandmother, who her entire life has been fraught with fighting cancer after cancer after cancer after failure after heart failure. And I got the best, the absolute best 16 months with my grandmother that I've ever had in my life.
Tell me what was so special about it, because she did something with you, like cooking or something, if I'm remembering your story.
So in growing up, she was a manager of a movie theater. And so I remember going and sitting in the reel box, and you've got that acid smell mixed with the popcorn, looking through the little window, watching these movies. And after that, she just got bouts of cancer and stuff, and she kind of was very, very distant. And I grew closer to my grandfather. Once he passed and she was at the point where she needed to be on a hospice service, there was almost like a reconnect that happened because she was no longer, I mean, for lack of a better term, debilitated by her condition. She was once again able to have people come to her and talk to her, and she wasn't constantly in pain. She wasn't constantly exhausted from the fight. She was just able to be. And in that moment of be, I was able to learn the reason why the popcorn tastes so good is because they used coconut oil. Like, that seems like a very simple thing, but I'd been trying to recreate that for years with her. But because we were able to have that moment, that conversation, I learned more about her life as a child. I learned more about my mother as a child and growing up. I learned more about myself in that 16 months.
That's beautiful.
Than I've ever had.
That's
because
really beautiful.
There was a block of a good 30 years that was just
she was just there.
Robbed by treatments, honestly.
I love it. I love that you had that opportunity, because we say three things around Aspire. We want to make every day the best we can, so we solve problems and we try to make connections with people. And because of those hospice services, you were able to reconnect those familiar, those very important relationships.
Yeah, and it goes back to what we were talking about before. I'm the director of nursing, and I still had no idea what we were doing, because in that moment, having it be my family member, your knowledge just completely, it's gone.
It is so true.
Even though I just did my entire day of work doing it proficiently, I'd get to her bedside and question, wait, am I supposed to do this? I know this.
Right. You're very good at your job.
But it's, once that emotion takes over, it takes you back down to that level of fear.
Right.
And luckily for me, that fear was based in watching her in pain. And I remember the day that she looked at me and she said, Ty, thank you. For the first time in 32 years, I'm at a level 2 pain. Wow. I have never known her to be at a level 2 pain.
That's incredible.
She's like, breathing used to hurt, and now I can think again.
That's so incredibly important. Ty, let's kind of change gears just a little bit. You've done such a great job here. This has been so wonderful to do a live with you. I'm going to have to pull you back in the office again.
We'll see. It takes convincing.
All right, Tice, there are specific diseases, and let's really get simple, because we understand it's really easy for clinicians like you. You're so smart. When we throw out diagnoses or terms, it's really easy for someone like you to understand those terms.
Well, it's very nuanced, and you've got to pick little pieces and kind of build this puzzle, kind of make a case for why this is going to be the case.
Sure.
But we want to take this down.
Simple.
Very simple.
Very, very simple.
We'll start with the simplest one. Cancer, untreatable, or doesn't want to be treated.
Okay. Yeah.
That's it.
That's it.
Simple.
Okay. Heart disease.
Heart disease, this is, even with medication, you can be on hospice.
Right.
But this is the point in which your heart can no longer heal. There's no surgical intervention, so no surgeries can fix this. Or you don't want to do the surgeries that fix this.
You know, and some of that signs would be like your edema in
you're going to have big legs. You're going to have a hard time breathing.
You're going to probably be on oxygen.
Yeah. Typically, we see people on oxygen at that point. Not always, because oxygen on hospice, it's a choice.
It is
Everything
a choice.
on hospice is a choice.
Isn't that a neat thing?
Yeah, it really is. It's kind of strange in the medical industry. You kind of feel this is your box, go,
Right.
But hospice, it's like, wait a minute. I know you're in this box, but let's go ahead and open this up. Let you do what you think.
You're going to do, like, you get social work, you get chaplain, and no one ever really knows in Utah what a chaplain really is. Right? And you get to talk about God. You get to talk about your relationship. Are you ready to meet God? You get pain medications. You've got a nurse who's your advocate with your physician that's advocating for you and what you want. You're right, because you've always stayed in these little boxes, and the medical industry is really rigid. And it's even getting more rigid, especially when it comes to pain control or accessing drugs that will make you more comfortable. And so having that advocate in your home to help advocate for what is best for you, what your wishes are, not necessarily what the doctor thinks is right. Okay, now here's a tricky one. Neurological disease. What is that?
Neurological disease is any disease that's going to affect your neurological pathways. Now that sounds like that doesn't always make sense. So this is where the dementia comes in. If you're not familiar with dementia, it's where am I? Who am I? What am I?
Well, yeah, and there's different kinds of dementia. Yeah. So the interesting thing about dementia is everybody says, well, what kind of dementia do I have? And the way I like to describe dementia is it's like the color blue. There are so many different shades
That's
of
a good
blue,
one. I like that one.
Right? So dementia is this big umbrella that says you have this big category of something, right? And of a disease. Your brain isn't functioning and firing like it used to, but there are so many shades of this different dementia. You could have Alzheimer's. There's multi-infarct dementia. I can't even remember all of the different.
I can't either.
But there's different shades. And some of them have very distinct patterns and some do not. Like the multi-infarct dementia is just pinpoint little teeny tiny strokes.
Mm-hmm.
And each little bit of stroke is like a step down.
Takes a little bit more.
Takes a little bit more of that person every single time they have a mini stroke. And they just may lose the ability all of a sudden to do something that they could do yesterday, and all of a sudden it just disappears. And so dementia is its own category. And when we're looking at hospice for dementia, are they kind of speaking 5 or 6 words ish?
And this is one of those ones where the government actually did a good job in explaining this.
Right.
There's a scoring system that we use. It's quite simple. We won't get deeply into that right now, but you mentioned the 5 to 6 words. Obviously, people will say more than 5 to 6 words and they have severe dementia.
Sure.
What this is when I'm having a conversation with you and you are responding appropriately,
and you keep getting
we keep getting, sometimes we're still going to have dementia in there because it's going to go onto a word loop, right. Or they can tell elaborate stories about their past, but the more recent stuff is very, very much not there.
Right. So one of the other really big neurological diseases that people don't really maybe realize is quite a neurological disease is Parkinson's. Parkinson's affects a lot of people. There's neurological diseases like ALS and MS, but Parkinson's, as somebody continues to age, is a really big disease category.
And with Parkinson's, really what it comes down to is the amount of assistance that you are requiring.
Right.
Because I've had many, many Parkinson's patients, and most of them are brilliant, absolutely brilliant. And their mind still just fires. Just perfectly.
Doesn't.
But their body just won't listen.
Oh, I've often wondered which is the hardest.
That sounds awful.
I don't know which is harder to be able to be fully functioning, but my mind isn't with me, or to know my mind is fully capable and with me, but my body isn't functioning.
I think that would be harder. It would be like your own personal prison.
Kind of. It would be very, very hard.
We try to fill that in. That's where
hospice comes in. That we could help make that quality of life that much better for that person.
Yeah.
Okay, we also have lung diseases, pulmonary health. That would be your COP.
The COPD people.
I just said that. What? Say the real words, not cardio.
No.
Now
that I'm chronic obstructive pulmonary disease. I had to think about it because we throw around COPD all the time,
along with CHF.
Yeah.
You're
like, wait a minute, what does that stand for now?
Right. Now, these are the people who get very big barrel chests because breathing is so taxing.
Yeah, you can pick these people out at the grocery store because it really is barrel chested, rounded, hard, because those muscles have had to build because of how much work it takes for them to breathe. These are people who are typically on oxygen, have to use multiple inhalers for comfort. Mm-hmm. They're on steroids to help with comfort. Yeah, they can't get around very easy without excessive fatigue because their body just is not getting what it requires to feed those muscles.
Right. Okay. And then kidney and liver disease. The big one would be if they're on dialysis.
Yeah. Dialysis is considered a curative,
so if they decide
restorative
they're done
treatment
with getting dialysis, because it is a taxing thing to go get dialysis.
Yeah, anyone who's seen someone on dialysis, they go in with the greatest gusto that they have, and they come out just wiped because it really does take everything out of them. And in this case, like we said, dialysis is one that until they stop that, it's not a qualifier. But as soon as they do, it's almost an auto qualifier.
Right. And then liver disease.
Liver disease is hard. You'll see larger bellies, lots of fluid, like in the legs, in the abdomen, belly area, in the arms. They'll just get big and tight, yellowing, very much yellow in the eyes, yellow on the palms and in the skin when it gets further on. But as far as like qualifying them, most nurses that we have can walk in a room and go, yep.
We can spot it right away. The other...
Do you want to... There's about 10 on. Do you want to see if they have any questions?
Does anybody have any questions that we need to answer for you? Me and Ty are just rambling
we're having a good time over here.
Okay. The last really big category we call protein calorie...
Severe protein calorie malnutrition.
And that is your elderly person that is just teeny and weighs very, very little.
This is a sentence diagnosis for failure to thrive. Mm-hmm. This is someone who does not want to eat anymore, who does not want to drink anymore, is losing weight even though they are eating and drinking. This is indicative of something else that's going on within their body that we might not know about.
Sure. Or maybe their body's
just failing,
just shutting down. Because we don't realize this, but our bodies are naturally designed to prepare to pass away.
And they follow a pretty charted course.
Charting, where they have very clear symptoms. And it's just the body's just preparing.
The way that I explain this to families is a chutes and ladders game. You know, there's this path that we know that it's going to take. There might be some jump upwards and there might be some slide downwards, but we know pretty much which way this game board is going and what's going to happen along the way.
Right. So there's a lot of signs. There's simple signs as far as when somebody's ready for hospice. But Ty, you know, the nice thing is that families don't have to do this alone. That's why we have wonderful people like you. These people, you do not have to go about trying to decide if it's time. We have Ty, we have our team here.
I have a very good team.
We're ready to talk to anybody who wants to find out, hey, this is where we are. And I know most people don't lay awake at night and go, I wonder what my hospice benefits are. Well, if you're wondering, hey, that sounds like my mom, or that sounds like my sister,
or just maybe,
give us a call.
Get one of us in there. We can tell you.
Even over the phone, we can give you an idea of where you are. And Ty's a really great person to talk to on the phone. And you don't have to do this alone. I think that's the biggest thing is that if you're struggling trying to care for your loved one, there are solutions out there. And if it's not hospice yet, we have a wonderful palliative team that can also help be your advocate with your physician in your home. I recently experienced the blessing of what it is to have a provider in your home, being able to be that advocate with you. Because sometimes in the healthcare system, what you don't realize is that doctors only talk to doctors.
Yep, it's a thing.
And it's a thing. And so really palliative becomes that liaison, I think is kind of the word. I was really thinking about this. We always wonder, well, how do you describe palliative care? And palliative care is where they become your personal liaison to speak for you on your behalf and get you things that maybe nobody's thought about for you in your home.
Not only that, they're also the bucket that grabs info from here and info from here and info from here. And they find, oh my goodness, you're on this medication, which counteracts this one, or this medication is causing this. So if we changed this, it would make this better. And they're just kind of this, they get to see the whole picture and then communicate it back out to all of your providers so that your providers can make better decisions as well.
That's right. So Ty, if people are seeing these signs, they should reach you at 801-292-0296.
Correct.
That's 801-292-0296. And remember, hospice isn't about losing hope. It's about gaining support, comfort, peace for family and patients, and quality of life.
Quality.
I think that's going to be it for today, guys.
Yeah.
Thank you.
Thanks for joining us.
Still live.